Hi guys, happy Tuesday. Today I am talking about OCD. It is a question and a topic suggested by many of you. It is something that affects a lot of people in different ways. There's many different forms of it, but it is a anxiety disorder. So again, it falls under that umbrella of anxiety disorders. Obsessive-compulsive disorder traps people in repetitive behavior and thought patterns that will leave them feeling disabled because it is something that will keep pulling you back. It has two different parts, which is the compulsions and another part, which is the obsessions. So I want to tell you exactly what obsessions are and what compulsions are. Obsessions are the ideas, right? So basically the thoughts that are recurring about a certain idea or worry. So it could be, oh, I have to go wash my hands because my hands are dirty. So worrying about germs. It could be, oh, the door is unlocked. I got to go check. You go check and then you come back in your car and you think, did I really lock it? Am I sure I locked it? You go back and you lock it again. So these are the obsessive thoughts that are part of this obsessive compulsive disorder. Then you have the compulsions. So the compulsions are the behaviors that are guiding you to make you feel better. The example that I gave you, oh, the door is unlocked. That is the thought, and the act of going and making sure the door is locked is the behavior. So we have two parts of it, the thoughts and the behaviors. We have the obsessions and the compulsions. A lot of you are asking me, when do you usually diagnose someone with obsessive compulsive disorder? It depends on when the onset is, and the onset is usually adolescence or early adulthood when people start having these thoughts. One of you guys messaged me and asked me, where does this disorder usually come from? Is it genetic or is it something that is learned? I think it's both. Research has shown that it could be predisposed biologically, or it could be something that is learned behavior, or also it could be something that is gained through experiences in life. Like if you come to an understanding that if you keep checking something and if you make sure that the door is locked, then it will keep you safe. So if you're learning these behaviors, if you're learning this way of thinking through your parents, through your teachers, it's something that can stick with you. Okay, now I want to talk about how can you help yourself with OCD, and when do you know it is needed for you to go seek help outside of yourself? Just like anything else, any other psychological disorder, if it gets in the way of your occupational, social life, if it gets in the way of your daily activities and routines, then I say that that's when you need to get some help. If it's at a controllable level where you feel like, okay, yes, I am having these thoughts that are coming in and they are intrusive, but I can handle it, meaning you are able to behave on it once and make sure the door is locked and you never think about it again during the day, then you're fine. But if the thought keeps coming in, even though you've already locked the door, that's when I would say you need to get some help. The help, again, like any other psychological disorder, usually it's the same across the board, is to reach out to a therapist or reach out to your primary healthcare provider and ask them for a good therapist in your area. And again, with this one, cognitive behavioral therapy, which channels your irrational beliefs, your thought patterns, and staying away from certain behaviors that are feeding into these obsessions. So again, the compulsions are the behaviors. One of the things that has worked for my clients is journaling their obsessions and staying away from the compulsions, because the compulsions are what give you a quick relief, so to speak. Like when you check the door, you feel better immediately, but it lasts a second and then you go back to worrying again. So to give yourself a designated amount of time to stay away from the compulsions. So tell yourself, okay, today I am going to act on these obsessions, meaning the compulsions, for 20 minutes a day. So giving yourself a designated window of time and not allowing yourself to act based on those obsessions any longer during the day, if that makes sense. So giving yourself a small window and seeing how that pans out after a week. Because basically what you're doing is that you want to bring back these reactions to these thoughts to a small window of time and get used to it eventually. So you want to build up your tolerance for not reacting to these thoughts. And eventually reducing the 20 minutes to 10 minutes, the 10 minutes to 5 minutes, and hopefully resolving the issue. Another thing that us therapists do is exposure therapy. So exposing the patient to exactly what it is that they're scared of slowly and getting their tolerance up. That's another way us therapists deal with this. And just so you know, OCD is a common disorder. So if you are diagnosed with it, just know that there's a lot of people that are also suffering from OCD, and it is something that can be treated. Okay, guys, that's all I had for you today. I hope this helped. Happy Tuesday. Can't wait to see you soon next week.